eye pressure goes high, then this affects the optic nerve or the main nerve of the eye, due to which the vision starts to go down. This is the problem. So the eye pressure can go high because one reason can be there can be some circulation problems of the fluid in the eye. Then the eye pressure can go high, or the production of the fluid can become more than what the drainage can happen. These are the reasons why the eye pressure can actually go high.
The conversation that we have had till now, we know that it is very important to detect early, and it is very important to go to the doctor and get evaluated to be able to diagnose glaucoma. So we should also know who are the people who are more predisposed to develop glaucoma and who would definitely require screening. So there are certain factors, risk factors of this disease that we have to be aware of, and all the public should be aware of. So if your age is say more than 40, so the chances of glaucoma increase. So everybody over the age of 40 should have a yearly or a 2 yearly checkup or screening at least for glaucoma, so as to be able to get picked up early so that the treatment can be started. Second and most important risk factor is family history of glaucoma. So as we were talking that the around say 2.3% of the population has glaucoma in a general term. But if you have a family member, that means if your parent is having glaucoma or your sibling is having glaucoma, the chances of you having glaucoma increase tenfold. So if there is a family member of glaucoma, you should definitely have screening. Okay, or anybody gets detected with glaucoma, they should encourage their family members to get screened for glaucoma so that they can be picked up early and the treatment can be started. Third risk factor is probably one who wear thick glasses, whether it is a high minus number or a high plus number. Worldwide problem, not only in India and Karnataka, but if you talk about in India, almost 12 million people have glaucoma. And what I'm talking about, 12 million people, is only the tip of the iceberg, because 90% of patients who have glaucoma, they do not even know that they have glaucoma, because it's a symptom-free disease. That means we call it as a silent disease or silent phagocyte. So people don't get to know. So 90% are not even diagnosed. And out of that, almost 1.2 million are blind due to glaucoma. So it is a major problem. If you look at the overall population, almost 2.3% is what is affected by glaucoma, which are diagnosed glaucoma. So that big is the problem. What is diabetes, what is hypertension, what is heart disease, but nobody would know what is glaucoma. So unless you know that it is a disease which can be, causing blindness and which has to be detected by frequent checkups, the doctors cannot help, because unless somebody comes to the doctor for the help or for checkup, it cannot be detected. So the awareness among us general population is the most important and impactful way of preventing blindness from glaucoma. And that is the job. I think that is why we are all sitting here taking your help to spread awareness among us general population that glaucoma is a disease which is blinding, but it can be controlled if detected early. So we should encourage our people around us, our family, our friends to get checked so that it can be detected early and you can have a normal, simple and good quality of life.
They have glaucoma. Second thing, even those who have glaucoma, 10% of them will go blind. In those people who are going blind, 90% of the majority of them we can save from blindness. It's a preventable cause of blindness, provided we give proper treatment to them. That is the reason we want to drive the awareness among public that it is important to diagnose glaucoma. I think Dr. Agarwal may have questions about how to diagnose and all that, right?
Yeah, I think these myths and facts, getting those facts correct is very important, especially for conditions like glaucoma, which is very silent. Thank you, Dr. Suresh, for that. So, Dr. Sushma, although glaucoma is a symptomless in the beginning, so do you throw some light on any risk factors which can tell someone that they may have glaucoma, or they need to go to doctor to get themselves checked?
Yeah, so I think by the conversation that we have had till now, we know that it is very important to detect early and it is very important to go to the doctor and get evaluated to be able to diagnose glaucoma. So we should also know who are the people who are more predisposed to develop glaucoma and who would definitely require screening. So there are certain factors, risk factors of this disease that we have to be aware of.
Control glaucoma. So these are very important things. Some facts about it. So with prevention, a very important fact. See, one fact is majority of the people with glaucoma do not know they have. This is an extremely important fact. See, the whole awareness, why are we driving this awareness program? Why do we need awareness? Why does not, say, for example, I give you an example of appendicitis. Appendicitis does not need awareness. Have you ever seen any awareness campaign going on for appendicitis? No, because what happens in such conditions is, as soon as you get the pain, you run to the doctor. That does not happen with conditions like glaucoma. Okay? Because glaucoma is one condition where people do not know that they have glaucoma. We call it as silent thief of vision. What is silent thief of vision? It steals your vision without you being aware of it. That is the silent thief of vision. So 90% of people who have glaucoma are not aware that they have glaucoma. This is a very shocking fact. Only 10% are aware. So this means the number of people whom we are treating are only 1/10. 10% of people are coming to the hospital, 10% we are treating them. That's the only number of people that we know. 90% of the people, they are out there in the city or in the villages out there in India. We are not even aware they have glaucoma. They are not aware they have glaucoma. They are not taking treatment, because of which what happens is they will go blind with glaucoma. Okay. Now, out of this 12 million people with glaucoma, nearly about 10% of them eventually will go blind. These are all approximate statistics. So this is a very huge number. Imagine 1 million people. ತಾರೀಕು ಮಾರ್ಚ್ ವರ್ಲ್ಡ್ ಗ್ಲಕೋಮಾ ವೀಕ್ ಅಂತ ಇದನ್ನ ನಾವು ನಡೆಸ್ತಾ ಇರೋದು ಯಾಕೆ ಅಂತಂದ್ರೆ, ನಮಗೆ ಎಲ್ಲಾ ಜನರಿಗೂ ಈ ಕಾಯಿಲೆ ಬಗ್ಗೆ ಗೊತ್ತಾಗಬೇಕಾಗಿದೆ. ಈ ದೃಷ್ಟಿ ಕಳ್ಳ ಅನ್ನೋ ತರ ಕಾಯಿಲೆ ಯಾರಿಗೂ ಗೊತ್ತಾಗಲ್ಲ ಅನ್ನೋದಕ್ಕೋಸ್ಕರ ನಾವು ಏನ್ ಮಾಡಬೇಕು ಅಂತಂದ್ರೆ, ಈ ಅವೇರ್ನೆಸ್ ಕ್ರಿಯೇಟ್ ಮಾಡೋದು ತುಂಬಾ ಮುಖ್ಯ ಆಗುತ್ತೆ. ಸೊ ಇದರಿಂದ ಎಲ್ಲರಿಗೂ ಈ ತರ ಅವೇರ್ನೆಸ್ ನಾವು ಮಾಡಿದಾಗ, ಇದರಿಂದ ಗೊತ್ತಾಯ್ತು ಅಂತಂದ್ರೆ ಅವರು ಜನ ಅದಕ್ಕೆ ಬಂದು ಚೆಕಪ್ ಮಾಡಿಸ್ಕೊಂಡು ಈ ಕಾಯಿಲೆನ ನಾವು ಕಂಡುಹಿಡಿಬಹುದು. ಥ್ಯಾಂಕ್ ಯು.
World Glaucoma Week starting from 12th to 18th March 2023. So every year we sort of observe this week to spread awareness about glaucoma. Now glaucoma is a disease which is a long-term disease and it slowly takes away the vision. So it is called silent thief of sight, because slowly patients keep losing vision and it takes away the peripheral vision first and the central vision last. That is why the patients do not get to know that they are losing vision. So it is very important to have a regular eye checkup, particularly for patients who have risk factors for glaucoma, like if the age is more than 40 years, if any family member has glaucoma, if you've had any injury to the eye, or if you're wearing thick glasses, or your eyes keep getting red off and on. So such patients should definitely have a screening of glaucoma so that it can be detected early and the loss of vision can be prevented. Thank you.
ವರ್ಲ್ಡ್ ಗ್ಲಕೋಮಾ ವೀಕ್ ಅಂತ ನಡೆಸ್ಕೊಂಡು ಬಂದಿದ್ದೀವಿ. ಈ ಗ್ಲಕೋಮಾ ಅನ್ನೋ ಕಾಯಿಲೆ ಏನು ಅಂತಂದರೆ, ಒಂದು ಕಣ್ಣಿನ ಬಹಳ ಮುಖ್ಯವಾದ ಕಾಯಿಲೆ. ಕಣ್ಣಿನ ನರ, ಆಪ್ಟಿಕ್ ನರ್ವ್ ಅಂತ ಕರಿತೀವಿ. ಕಣ್ಣಿಂದ ಮಿದುಳಿಗೆ ಹೋಗೋ ಅಂಥ ನರದಲ್ಲಿ ಡ್ಯಾಮೇಜ್ ಆಗುತ್ತೆ. ಈ ಡ್ಯಾಮೇಜ್ ಆಗೋದ್ರಿಂದ ಏನಾಗುತ್ತೆ ಅಂತಂದರೆ, ದೃಷ್ಟಿ ಸುಮಾರು ಕಡಿಮೆ ಆಗುತ್ತೆ. ದೃಷ್ಟಿ ಕಡಿಮೆ ಆಗೋದ್ರಿಂದ ಒಬ್ಬ ವ್ಯಕ್ತಿಗೆ ಮುಂದ್ಗಡೆ ಹೋಗೋಕ್ಕೂ ಕಷ್ಟ ಆಗುತ್ತೆ, ಅಥವಾ ಒಂದು ವಾಹನ ಚಾಲನೆ ಮಾಡಲಿಕ್ಕೆ ಕಷ್ಟ ಆಗ್ಬೋದು, ಅವನದು ಜೀವನ ಮುಂದುವರಿಸಲಿಕ್ಕೆ ಕಷ್ಟ ಆಗ್ಬೋದು. ಈ ಥರ ನಾವೆಲ್ಲ ಕಾಯಿಲೆ, ಇದು ಭಾಳ ರೇರ್ ಆದಂಥ ಕಾಯಿಲೆ ಏನಲ್ಲ, ತುಂಬ ಕಾಮನ್ ಆಗಿದೆ. ಆಲ್ಮೋಸ್ಟ್ ನಮಗೆ 2-3% ಅಷ್ಟು ಜನ ನಮ್ಮ ದೇಶದಲ್ಲಿ ಈ ಕಾಯಿಲೆಯಿಂದ ಬಳಲ್ತಾ ಇದ್ದಾರೆ. ಆದರೆ ಏನು ಅಂತಂದರೆ, ಇದು ನಮಗೆ ಡಯಾಗ್ನೋಸಿಸ್ ಆಗೋದಿಲ್ಲ. ಏನು ಅಂತಂದರೆ, ಕಂಡುಹಿಡಿಯಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ಯಾಕೆ ಕಂಡುಹಿಡಿಯಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ ಅಂತಂದರೆ, ಒಬ್ಬ ವ್ಯಕ್ತಿಗೆ ಇದು ಗ್ಲಕೋಮಾ ಇರೋದು ಎಷ್ಟೋ ತುಂಬ ಅಡ್ವಾನ್ಸ್ ಆಗೋವರೆಗೂ ಅವರಿಗೆ ಗೊತ್ತಾಗೋದಿಲ್ಲ. ನಾವು ಈ ಕಾಯಿಲೆಗೆ ದೃಷ್ಟಿ ಕಳ್ಳ ಅಂತ ಕರಿತೀವಿ. ಯಾಕೆ ಕರಿತೀವಿ ಅಂತಂದರೆ, ಅವರಿಗೆ ಈ ಕಾಯಿಲೆ ಇದ್ದರೂ ಕೂಡ ಗೊತ್ತಾಗೋದಿಲ್ಲ. ಆ 90% ಡ್ಯಾಮೇಜ್, 90% ಡ್ಯಾಮೇಜ್ ಆದಾಗ ಅವಾಗ ಗೊತ್ತಾಗ್ಲಿಕ್ಕಾಗುತ್ತೆ, ಆದರೆ ತುಂಬ ಲೇಟ್ ಆಗಿಬಿಟ್ಟಿರುತ್ತೆ. ಸೊ ಇದನ್ನು ನಾವು ಅವಾಯ್ಡ್ ಮಾಡಬೇಕು ಅಂತಂದರೆ ಏನು ಮಾಡಬೇಕು ಅಂದರೆ, ಹೋಗ್ಬಿಟ್ಟು ಪ್ರೊಆಕ್ಟಿವ್ ಆಗಿ ಐ ಡಾಕ್ಟರ್ ಹತ್ರ ಕಣ್ಣಿನ ಚೆಕಪ್ ನಾವು ಮಾಡಿಸ್ತಾ ಇರಬೇಕಾಗುತ್ತೆ. ನನಗೇನು ತೊಂದರೆ ಇಲ್ಲ, ಕಣ್ಣೆಲ್ಲ ಚೆನ್ನಾಗಿ ಕಾಣ್ತಾ ಇದೆ, ನನಗೆ ಏನೂ ತೊಂದರೆ ಕಾಣಿಸ್ಕೊತಾ ಇಲ್ಲ ಅಂತಂದು ನಾವು ಕಾಯ್ಕೊಂಡು ಕೂತ್ರೆ ನಾವು ಆಲ್ಮೋಸ್ಟ್ ಮೆಜಾರಿಟಿ ವಿಷನ್ನ ನಾವು ಕಳ್ಕೊಂಡ್ಬಿಟ್ಟಿರ್ತೀವಿ. ಈ ಥರ ಆಗೋದನ್ನು ಅವಾಯ್ಡ್ ಮಾಡಬೇಕು ಅಂತಂದರೆ ಪ್ರೊಆಕ್ಟಿವ್ ಆಗಿಬಿಟ್ಟು ಪ್ರತಿ ವರ್ಷವೂ 40 ವರ್ಷ ಆಗಿ ಮೇಲ್ಪಟ್ಟವರಿಗೆ ಪ್ರತಿ ವರ್ಷ ಹೋಗ್ಬಿಟ್ಟು ತೊಂದರೆ ಇರಲಿ ಬಿಡಲಿ ಹೋಗ್ಬಿಟ್ಟು ಕಣ್ಣಿನ ಚಿಕಿತ್ಸೆ ಹತ್ರ ಹೋಗ್ಬಿಟ್ಟು ನಮ್ಮ ಕಣ್ಣನ್ನು ಚೆಕಪ್ ಮಾಡಿಸ್ತಾ ಇರಬೇಕಾಗತ್ತೆ. ಆ ಥರ ತೋರಿಸಿದಾಗ ಅದನ್ನ ಬೇಗನೆ ನಾವು ಪಿಕಪ್ ಮಾಡಿಬಿಟ್ಟು ಡಯಾಗ್ನೋಸಿಸ್ ಮಾಡಿಕೊಂಡು ಅದಕ್ಕೆ ನಾವು ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಕೋಬೋದು. ಈ ಥರ ಕಾಯಿಲೆಗೆ ಏನೂ ಕ್ಯೂರ್ ಇರೋದಿಲ್ಲ ಅಂತಂದರೆ ನಾವು ಇದನ್ನ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಬಿಟ್ಟು ಹೋಗೋ ಥರ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ನಾವು ಏನು ಮಾಡ್ಬೋದು ಅಂತಂದರೆ ಇದನ್ನು ನಾವು ಪ್ರಿವೆನ್ಷನ್ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗಲ್ದೇ ನಾವು ಅದನ್ನ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ಬೋದು. ನಾವು ಯಾವ ಸ್ಟೇಜಲ್ಲಿದೆ ಆ ಕಾಯಿಲೆ ಅದನ್ನು ನಾವು ಅಲ್ಲೇ ಉಳಿಸ್ಕೋಬಹುದು. ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಬಿಟ್ಟು ನಾವು ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟು ಈ ದೃಷ್ಟಿನ ಉಳಿಸ್ಕೊಂಡ್ರೆ ಅದು ಎಷ್ಟೋ ಸಹಾಯ ಆಗುತ್ತೆ ಪೇಷಂಟ್ಸಿಗೆ. ನಾವು ಲೈಫ್ ಲಾಂಗ್ ಕಾಣಿಸೋ ಥರ ಇಟ್ಕೋಬಹುದಾಗತ್ತೆ.